After the age of 70, taking care of your health requires a more cautious and intelligent approach. Not every medical test brings real benefits. In fact, some health screenings we've long believed to be preventive may unintentionally cause harm. Many older adults get caught in the cycle of unnecessary tests, leading to anxiety, overtreatment, and risky medical procedures. This video highlights 5 types of screenings that people over 70 should carefully reconsider before undergoing, from colonoscopies and full body scans to routine cardiac stress tests. These tests sometimes uncover benign abnormalities, things the body can live with without issue. But they can trigger a chain of unnecessary interventions, including biopsies, surgeries, or long-term medications. More importantly, as we age, the body responds to sedatives, procedures, and recovery much more slowly than it does in younger individuals. This means that the consequences of a seemingly harmless test can become far more serious. The main message of this video is this: you have the right to say no to unnecessary medical tests. Staying healthy in older age doesn't mean constant testing. It means being selective, listening to your body, focusing on quality of life, and steering clear of interventions that don't offer real value. Don't blindly follow health screenings. Truths every senior over 70 should know. Once you pass the age of 70, taking care of your health is no longer just about regular checkups or doing every test available. More importantly, it's about being selective with what your aging body truly needs. In reality, many medical tests that have long been recommended when we were younger can actually do more harm than good as we grow older. Many older adults still believe that the more tests they do, the more peace of mind they'll have. However, according to geriatric specialists and modern physicians, this belief no longer aligns with the reality of aging bodies. Undergoing too many unnecessary screenings can lead to anxiety, misdiagnosis, overtreatment, and even dangerous complications. This video is created with the purpose of protecting senior health through understanding, not fear or alarmism. We will help you gain a clearer view of 5 common health tests that may seem good for prevention, but can actually result in serious consequences if done at the wrong time. From colonoscopies to full body scans and cardiac stress tests, each of these carries risks if not properly indicated. The key is not to do every test, but to know which tests are truly necessary and which ones can be safely avoided. Every body ages differently, and what worked well at age 50 may no longer be appropriate at 75. This isn't advice to ignore your health. It's a reminder of the wisdom needed to care for yourself appropriately as you age. We understand that as we grow older, feelings of insecurity about our health can become more common. But instead of relying solely on machines to search for every possible issue, start learning to listen to your own body. Ask your doctor important questions like, will this test actually change how I'm treated? What risks does it carry for me? And, is there a gentler alternative? This video is an invitation for older adults to enter this stage of life with a different mindset, not one of fear or pressure, but one of clarity, self-awareness, and the confidence to say no to things that are no longer needed. Because living well in old age is not about spending more time in hospitals. It's about living freely, proactively, and with true quality. The colonoscopy trap after age 70. Benefit or harm? For decades, colonoscopy has been considered one of the most effective methods for screening colon cancer. However, after the age of 70, especially in those without clear digestive symptoms, this test may bring more risk than real benefit. The issue doesn't lie in the technology itself, but rather in how we apply it to an aging body. As we get older, our bodies no longer respond as flexibly to invasive procedures as they once did. Colonoscopy requires thorough preparation, including complete bowel cleansing, a process that causes significant dehydration and electrolyte imbalance. For seniors, this preparation phase alone already carries risks such as low blood pressure, extreme fatigue, or loss of balance. Moreover, the sedatives used during colonoscopy add another layer of risk. Older bodies metabolize medication more slowly, allowing the drugs to remain longer in the central nervous system. This can lead to confusion, dizziness, and even falls after the procedure. What seems like a minor incident can have serious consequences, such as fractures or long-term mobility loss. A prime example is George, age 82, healthy, sharp-minded, and with no digestive complaints. Despite this, he was encouraged to undergo a routine colonoscopy. During the prep and recovery process, he became severely dehydrated and confused, leading to a fall at home that fractured his hip. The ironic part? His colonoscopy result was completely normal. No polyps, no abnormalities. Furthermore, colonoscopies in older adults often lead to unnecessary medical interventions. Many polyps found during the test are benign and extremely slow-growing. It could take 10 to 15 years for one to become cancerous, if ever. Yet once detected, even a harmless polyp can spark fear and push patients toward unnecessary removal surgeries. That's why, if you're over 70 with no symptoms such as persistent abdominal pain, prolonged diarrhea, or a family history of colon cancer, it's entirely reasonable to say no to colonoscopy. Today, there are safer alternative screening methods, like routine stool tests that check for hidden blood or abnormal DNA. The core message is this: prevention doesn't mean agreeing to every test, but rather weighing the benefit against the risk. When it comes to colonoscopy after age 70, sometimes the wisest way to protect your health is through caution and thoughtful decisions. Full body scans. After age 70, prevention or unnecessary worry. A full body scan may sound like a smart step in disease prevention. We often believe that if we catch something early, we can avoid bigger risks later. However, for individuals over 70, undergoing a full body scan without a specific medical reason can lead to unexpected consequences, both physically and mentally. CT and MRI machines used in full body scans are extremely sensitive. They can detect tiny abnormalities, things that the body could coexist with for a lifetime without ever causing harm. But once these small spots, shadows, or potential lesions are found, they often trigger fear in the patient. The thought of something might be wrong with me begins to take hold, setting off a chain of follow-up tests, biopsies, and even surgeries, many of which turn out to be completely unnecessary. Take, for example, Mrs. Betty, 78 years old, completely healthy, walking daily, and without any troubling symptoms. During a community health fair, she was offered a discounted full-body scan at a mobile clinic. The scan detected a very small lesion on her kidney, something that posed no threat to her health or longevity. But the word lesion caused extreme anxiety. A doctor suggested surgery just to be safe. The outcome: months of recovery, reduced energy, and disrupted daily life, all from a finding that didn't warrant intervention. It's not just the body that suffers. Seniors are also especially vulnerable emotionally after undergoing unnecessary procedures. Having to lie still for long periods in the scanner, waiting anxiously for results, and then navigating through layers of complex medical information can lead to exhaustion, sleepless nights, and a constant state of worry over what might be wrong. Worse still, most full-body scans aren't covered by health insurance. Many older adults end up paying out of pocket for what ultimately amounts to false peace of mind. The message here is clear. If you don't have specific symptoms and haven't been advised by your doctor, stay away from routine full-body scans. Aging bodies don't need every tiny detail examined. What they need is attention to real signals and the wisdom to avoid unnecessary medical pathways. After the age of 70, staying healthy isn't about chasing every abnormality. It's about living calmly, clearly, and selectively, choosing your care with intention, not fear. Cardiac stress tests. After age 70. Necessary or better avoided? For decades, the cardiac stress test has been regarded as an essential tool for detecting early signs of heart disease. However, once you reach the age of 70, routinely using this method, especially in people without any symptoms, can lead to unforeseen and serious consequences. After 70, the human body undergoes many natural changes. Arteries become stiffer, heart rhythms may vary, and blood pressure fluctuates more. These are entirely normal signs of aging, but medical machines can misinterpret them as indicators of disease. As a result, many seniors receive diagnoses like suspected heart disease, even when their heart is functioning normally. These false positives can trigger a chain of unnecessary medical interventions. Patients are often sent for coronary angiograms, stent placements, or even heart surgeries. These are invasive procedures with high risks, especially for older adults whose physical resilience is lower and whose recovery takes longer. Mr. George, 74 years old, is a clear example. He had no cardiovascular symptoms, no chest pain, no shortness of breath, no unusual fatigue. Yet, during a routine health checkup, his doctor recommended a stress test, just to be safe. The test revealed a minor abnormality, and within weeks, he underwent a stent placement procedure. Not long afterward, he developed an infection at the site of intervention, leading to hospitalization and months of ongoing treatment. His once active and healthy lifestyle was replaced by a long, exhausting recovery and reduced functionality. This isn't a rare occurrence. Leading cardiology and geriatric associations now strongly advise against routine cardiac stress testing in older adults who do not show clear symptoms. If you don't experience signs such as chest pain, difficulty breathing during light activity, rapid heartbeats, or unexplained fatigue, then undergoing a stress test may be more harmful than beneficial. After 70, caring for your heart is no longer about detecting every possible problem early. Instead, it's about understanding your body, maintaining a healthy lifestyle, staying gently active, and paying attention to real symptoms. Trust this. It's not machines, but your own body that sends the most honest and accurate signals about your heart health. Routine colonoscopies. After age 70. Valuable benefit or dangerous burden. Colonoscopy has long been praised as the gold standard for screening and preventing colon cancer. However, once we pass the age of 70, it's time to reconsider. Does the benefit of this test still outweigh its potential risks? Increasingly, medical experts are warning that the routine use of colonoscopies in older adults may cause more harm than good. As we age, the body no longer recovers as quickly as it once did. Factors such as declining liver and kidney function, a more sensitive nervous system, and reduced balance make colonoscopy a procedure with significant risks for seniors. The first concern is sedation. To perform a colonoscopy, patients are typically given anesthesia or mild sedatives. While younger bodies can metabolize these drugs quickly, in older adults the effects can linger, causing confusion, dizziness, and disorientation. These side effects significantly increase the risk of falls, which are one of the leading causes of serious injury among the elderly. The second concern is the preparation process. High-dose laxatives are used to cleanse the colon, but in older adults, this process can lead to dehydration, electrolyte imbalances, and low blood pressure, leaving the body exhausted for days. For seniors who live alone, the risk of falling in the bathroom at night due to dizziness is very real. A heartbreaking example is the story of Eileen, age 78. She had previously undergone 2 colonoscopies with normal results. Still, her doctor recommended a third just to be safe. During this last procedure, her colon was perforated, a rare but extremely serious complication. She required emergency surgery and spent nearly a month in the hospital. Although she recovered, her health and emotional well-being never fully returned to their previous state. So what's the right choice? Leading medical organizations now advise that if someone over 70 has already had 1 or 2 normal colonoscopies and has no suspicious symptoms, such as unexplained weight loss, ongoing abdominal pain, or blood in the stool, then they should not continue routine colonoscopies. Instead, the focus should shift to maintaining a healthy lifestyle, monitoring for real warning signs, and, if needed, opting for less invasive screening methods. After 70, the goal is no longer to examine every corner of the body, but to carefully choose what is truly necessary to protect your health, independence, and overall quality of life. Overuse of routine heart tests. After age 70, when being careful becomes a burden. Many older adults, even when feeling perfectly healthy and showing no unusual symptoms, are still advised by their doctors to undergo routine heart screenings, typically stress tests or angiograms. This may sound reasonable, as everyone wants to prevent rather than treat. But for those over 70, undergoing heart tests without clear symptoms can sometimes lead to serious consequences, ones that may be worse than the condition being screened for. Modern heart tests, while advanced, are not flawless. In older adults, cardiovascular changes often occur as part of natural aging. Arteries may become slightly stiff, heart rhythms may be mildly irregular, or blood flow might decrease slightly during exertion. These changes are not necessarily signs of disease, but medical equipment can still interpret them as abnormalities. As a result, many seniors receive diagnoses like at risk and are led into a chain of unnecessary treatments, including angiograms, stent placements, and long-term use of blood thinners. One clear example is Mr. Harold, 76 years old. He enjoyed walking daily, played with his grandchildren, and had no chest pain, fatigue, or shortness of breath. During a routine checkup, his doctor suggested a stress test, just to be safe. The result showed a minor irregularity. Even though it caused no symptoms, the doctor recommended stent placement to prevent future risk. Just a few days after the procedure, Mr. Harold suffered internal bleeding due to a reaction to the blood thinners. He was hospitalized in an emergency and spent months recovering. Harold's story is not unique. Many older adults are treated aggressively for conditions that haven't yet caused any symptoms. And in many cases, the interventions themselves become the source of pain, complications, and anxiety. Today, cardiology experts offer clear guidance. Only perform heart tests if there are specific symptoms, such as chest pain when walking, breathlessness while climbing stairs, unexplained rapid heartbeat, or feeling unusually exhausted during light activity. If you're functioning normally and experiencing no warning signs, your body is already telling you that your heart is doing its job. After age 70, taking care of your heart isn't about hunting down every hidden threat. It's about listening to your body, maintaining a healthy lifestyle, and only intervening when truly necessary. Sometimes saying no to a test is the best way to protect your peace of mind, your independence, and your overall quality of life. Health. After 70, choose wisely instead of chasing every test. As we grow older, many of us feel pressured to undergo all kinds of medical tests to reassure ourselves that we're still healthy. Whatever the doctor recommends, we follow, thinking that the more tests we take, the safer we'll be. But the truth isn't that simple. After age 70, what you truly need is not a packed schedule of screenings, but smart, selective decision-making, knowing when a test is necessary and when it's okay to say no. Medical tests shouldn't be done just to be safe or out of habit from younger years. The aging body is very different. It fatigues more easily, is more vulnerable to harm, and takes longer to recover. That's why every test must be carefully weighed against three key factors: its real benefit, its potential risk, and its cost, not only financially but also mentally and physically. A test that seems simple may open the door to a chain of unintended consequences: anxiety over a suspicious result, the need for further invasive testing, or even unnecessary surgery. Meanwhile, what your body may need most is stability, peace of mind, and the ability to maintain independence and daily joy. Medical technology is becoming increasingly advanced, but don't let it drown out the voice of your own body. A slightly faster heartbeat or a small shadow on a scan may be completely normal for older adults.